Welcome to today's 4Ps podcast. Today we have a guest that has been on this program before. However, you did not know who it was because she was pixelated. And she did not want to show herself because she was, I don't want to say scared. I want to say that she wanted to keep her identity quiet. And then something happened that made her want to change that whole stance. She actually has a book out. It is called Heroin. Yes, you probably know her now as Prudence Vector, but it's not. Her name is Chastidy Mader. She is going to be here talking about her book. She's going to be talking about the medical field and some of the dangers that go on in the medical field. And we will be right back right after this.
Every story begins with the truth. Some stories are meant to inspire. Some are meant to heal. All deserve to be heard. At Veritas Publishing House, we bring truth to life through the written word. At Veritas, we guide authors from vision to visibility with purpose, planning, passion, and persistence. This is more than just publishing. It's legacy. Veritas Publishing House, publishing truth, inspiring purpose.
Hello and welcome back to the 4Ps podcast. I have a guest on the show who is a returning guest. And you may ask yourself, I've never seen her before on our podcast. And no, you have never seen her before on your podcast. However, she has been on this podcast before. As you guys know, there is a book that's out called Heroin. It is an outstanding book. It really is. It is a great book. It talks about something that we as patients probably don't want to hear, and it's just telling you that as just as point blank as possible. We don't want to we don't want our healthcare workers in a situation where they are not functioning at their clearest capacity, but this woman right here actually showed up on our podcast before as a woman by the name, a fictitious woman by the name of Prudence Vector. And something happened, and she released the book as Prudence Vector and things like that. Something happened where she actually said that she could no longer hide in the shadows. And not only does she no longer want to hide in the shadows when it comes to the podcast, she also no longer wants to hide in the shadows as far as the book is concerned. And her name is Chastidy Mader. Used to be, well, never was really, Prudence Vector. Chastity, welcome to the program. First, how are you doing?
I'm good. Thanks for having me on the show, Trunnis. I appreciate that. I'm excited about the ability to share a little bit about the book and what led me to write it.
Thank you so much. But what I want to ask you first, Chastity, is what led you to say, I'm not doing this under, I'm not doing this under a veil or whatever?
So there was a couple of reasons that that led me to decide to come out of the shadows there. There was a nurse that got in trouble for drugs and arrested, and there was a big story about it, and I felt for her because there was an immediate attack on her character, and I really don't know her personally, and I really don't know a lot about her story. I just felt for her based on circumstances that happened to me, I guess now around 11 years ago. And then also I was starting to work in my own career helping those people that were addicted and that are addicted. And there were some people that were like me that reached out to me that I had no idea were addicted. And so because of those things, I realized that unless I come out of the shadows and I show my face and I'm willing to lead other people out of that prison, that really nobody is going to know who to reach out to or where to go, how to accomplish recovery. It's like, I remember all these years ago, I was having one of these episodes because I was really bad. I wasn't just like addicted to pain pills and still functioning. It got to the point where I was on the street. I was, one of these people that you see nodding out at the bus stop, and it got really bad. And so because of that type of situation, I would end up in the hospital, for different reasons. Sometimes I just needed a warm place to be. Sometimes I was hungry. Sometimes there was infection. And I remember being in the hospital and being treated terribly by who were my own people, other nurses. And I was too ashamed to tell them that I was also a nurse, but I remember feeling like that's not how a nurse should be treating another human being. Not only
No.
another nurse, because like I said, they didn't know that I was a nurse. But the only term that I can ever think of to describe how I felt in that situation was like, I felt like I was being treated like a scary, dirty insect that they didn't want on them or to be touched by them or to even look in that direction. And I remember feeling like if somebody would tell me how to get out of this situation, or if they knew the path, or if they just, put their hand out for me to grab and let me walk alongside them or behind them even, I would have jumped up out of that bed and followed them.
Right.
So in that situation, I remember I was laying in that bed, and I remember I was like, God, if you will restore my life, I will be that nurse that I needed all those years ago. And he was very faithful, because he's brought me to places that I never imagined was possible after living that type of lifestyle. Now, I was a nurse before that, obviously, so I knew how to function as a nurse. I knew what the expectations were. However, the expectations are too high.
Right.
I understand why they're high, and I do understand that there is very minimal room for error, especially when you're dealing with a human life. However, we are human, all of us. And so there needs to be not only that understanding, but that education as a person is being trained to be a nurse. So there's a lot attached to this. And I was thinking about this morning as we were coming up on the time to do this podcast, because I was fearful. And it's not because I'm fearful to talk in front of people or to share my story. It's just I had to start digging in to see why was I feeling like that. And the core of it is still this young nurse that's inside of me that feels like I have no room to be human. And I certainly cannot admit to anybody else that I'm human, and for that fear of judgment from other people saying, you're human.
So, I'm going to tell you, I'm talking now, I'm not a medical professional at all, but we are engineered when we go to a hospital, when we go to a doctor's office, when we go to an urgent care or something like that, we go in sick, we come out better. Okay? Anything less than that is just poor service on the fact of, and that's why we're engineered. That is not the truth in any way, shape, or form, but that is our expectation. We expect if I have the flu going in, when I come out 10 minutes later, I no longer have the flu. Thank you very much for making me feel better. I'm done. Now, the thing is, because that is our expectation, I know for a fact, because now I'm speaking, I am a doctor in business. I do have a doctorate in that. And I know that there's an expectation that when you marketing and this, that, and the other, you have to market towards those expectations. So what you do is you create a culture from probably somebody head up who's never even touched a body in his life or her life. And you create a culture saying that, you know what, Chastity, as the nurse, when our customers leave, which in our case, the customer is the patient, they have to make sure that you have met all of their expectations, even if you can't. Is that one of the pressures that you, as a nurse, as a nurse and as a practicing medical professional, is that something that you go through quite a bit?
It is. And because we've all been sick, we've been in that position. And when we go, we really need someone to help us to feel better, because it's not just that we're sick. It weighs on your mental health. It weighs on your physical health. It weighs on the people around you that have expectations of you and things. So when someone comes to you and is asking basically for healing, and you can't provide that, not only does it let them down, but it makes you feel down as
Right.
well. And so it's a tough situation to be in. However, what I've learned over the years is that if you can't necessarily make them physically feel better in the moment, you can listen to them, listen to their symptoms, empathize with them, and let them know at the very least that you care, that you empathize, that you've possibly experienced this situation before. They like to know that they're not alone.
Right. You talked, and it says this in the book, it talks about the pressures that you're under as far as like not wanting to take a break or not feeling that you need to take a break, not needing to eat, not needing to sleep. Those pressures are on you quite a bit. Is that correct?
It is. It's
And
very much so.
does that lead people? And I don't want this question itself is a leading question. If I was in court, this is what they would say. That's a leading question, Trunnis, but it is, and I'm sorry. But do you think that leads people to at least be tempted to get into performance and substance abuse issues?
Yes. And I understand what you're saying about leading, et cetera, but it brings up a point that I was going to touch on anyway, the foundation of basic human needs. And I like to go back to Maslow's hierarchy of needs because I learned that early on in my nursing education, the basics of what a patient will need. And so we we teach them that, we preach that, we facilitate that. However, we do not do the same thing for fellow healthcare providers.
Right.
And it almost becomes a source of shame. And so I was looking at this a little bit before we started this podcast, and the very basic foundation of it is physiological needs, which includes food, water, shelter, sleep, clothing. So obviously some of those needs are met. The
Right.
other ones, there's a huge gaping hole where you're left to try to figure out how to fill those gaps for yourself when nobody is telling you how to do that. No one is facilitating your ability to do that. And not only are those gaping holes there and you're trying not to fall through them, they get bigger as
Right.
time goes on. The patient load gets bigger. The acuity, it gets more. Your exhaustion increases. Your lack of ability to eat throughout a shift starts to make you not be able to think straight. And that's not a place where you can do that. So it gets to the point where, again, if you are not given that break, you learn to take that break on the go. And
Right.
how can you possibly do that? Well, substances. Substances will relieve anxiety. They'll relieve pain. They'll increase your ability to not need rest or to be able to sit down. And I hate that because those substances that fix those problems are available to you.
Yeah, I mean there's a cabinet. You don't even have to go that far. There's a cabinet because you're going to give them to us to help us. So let me just take a little bit off the top and go from there.
It's very unfortunate. It's like, oh, I've been there and I hate that I've been there. But really, is the system broken with just the fact that I'm a bad person? Absolutely not. I was
No.
never, and the same thing with other healthcare providers. We didn't just wake up one day and decide that we were going to be bad people and we were going to take things, or it doesn't matter where we get them from. The fact of the matter remains that the hierarchy of needs is being ignored, and our needs remain and the patient's needs remain. So that's where the
Absolutely.
problem is.
And there's one thing I do want to add. You said I'm not a bad person. I will tell you this right now. You're not a bad person. You're not a bad person at all. What it is it's almost like I was watching. I was going to say I was talking to you. I was not. I was watching an interview with a hockey player. His name is Tyler Ennis. He was a great player. He played for my favorite team, the Buffalo Sabres, for a while. I think he played for the Edmonton Oilers. He skated around quite a bit. He was a smaller player. I would say he was an absolutely talented. He was a very talented player, but he was one of those players that, you know, he was there, but he could be called down at any given time. So, you know, there was always somebody. He was always looking over his shoulder for his replacement, so to speak. And he said he had an issue with concussions, and what they would do is, because of the demand that they had on him, and because of the competition behind him that were ready to take his job at any given time, sometimes he would fake. You know, he would say it was commonplace for hockey players to say they were all right when they really weren't all right. And the NHL, and I love the NHL, I'm not dogging the NHL, please don't sue me, NHL, when I say this, but the NHL, they're all about money. They're like, okay, if he said he's all right, he's all right. Okay? And so these people would go out, and then that led to other medical conditions, CTE, all that other stuff. It sounds to me, the way you're talking, that is almost the same exact thing that's happening in the medical field. Am I wrong for saying that, or is that what's happening?
No, you made me think of a very specific situation in my career. I was thoroughly addicted to opioids at this point, and benzodiazepines at the same time. And
Can I stop you for 1 second?
Uh-huh.
I need to stop you for 1 second because I have no idea what whatever you said. What are those?
Benzodiazepines.
Thank you.
Yeah, those are nerve pills, like Klonopin, Xanax,
Okay, roger that.
Yeah,
Okay.
anxiety medication, like
Okay.
controlled anxiety medication.
Okay.
So I was addicted to both of those, and that was because I had gotten to the point where I had recognized the fact that there was going to be no break, there was going to be no excuse, there was going to be no exception, that wasn't going to be the case. I was expected to perform at 100% all of the time, as much as humanly possible. Actually, it's above human possibility.
Yeah.
So I was addicted to those things, but I was also recognized for my high performance level more than I ever had before in my career. Matter of fact, I was offered a promotion. So I was doing things that were incredibly wrong, not only for the people around me, but for myself. And I was rewarded for it. And I'm not the only one that I know that's happened to, because I've worked with other nurses that I know have been impaired, not because they're bad people or any of that. It's because I recognize it because I've been the impaired nurse. So you can see it. You recognize the behaviors. You hear the sniffling. I don't know if that makes any sense, but
Yeah, it makes a lot of sense. Yeah, absolutely.
So you notice their weight loss. You notice the dark circles. You know, so I can recognize it from a mile away, and I am never am I in the position where I'm angry with them or I'm looking down on them or judging them. My heart breaks, really, because I've been there, and it just, you know, I just, knowing that everything that I have gone through and the trouble, like the climb that I've had to claw my way back to just a position where I feel like people might accept me again in the career that I have is nearly impossible.
Yeah.
How I got to this point is strictly because God decided that I was going to be one to get back here. And I want that for other people. I do. But I'm not sure how possible it is with as tough as they make it, not only to be a bedside nurse or any kind of nurse, but how are they going to beat addiction and then teach themselves, when they've already taught themselves how to handle that stress with drugs, how are they going to come back and do it without that? When the patients
and
are
the funny
screaming
thing
at
is,
family.
And in your case, how are they going to tell you that drugs are wrong when, in your case, you're being rewarded for doing the drugs? I mean, granted, it's a superficial reward, I understand that, but it's still an award. Hey, I did these drugs and I got promoted at work. So if I stop doing drugs, then I'm going to probably lose this position. or I'm not going to perform at the same capacity. Today, I don't want to give up too much of the book. The book is outstanding. I want to tell my audience right now, the book is outstanding. It's going to have a different cover. It's going to have a different everything. It's just going to look great. It's going to be great. The greatest thing about it is now she's no longer hiding behind things. She is available, and this is going to be in the podcast notes. She's available to speak and things like that. And I'm going to tell you right now, this is somebody you want to hear. You want to hear her talk, and that's why I don't want to give too much away of it, too much of it away today. But what I do want to talk about is you went from drug addiction to today. Not only are you a practicing medical professional, you also have started your own medical practice. Now, before you say anything, okay, I want to tell you, I know your family, all right, and this is in full disclosure. I know who you are. I know and absolutely adore your husband. He's a great individual. He's a strong individual. I want to say this, and I mean this. I love when people redeem themselves. I love it. My favorite person in history is Ulysses S. Grant. And Ulysses S. Grant was kicked out of the army for drinking. Okay? And within 15 years, he was running the entire army. As a matter of fact, if it wasn't for him, we would have had a different outcome in the Civil War. And that man, Ulysses S. Grant, totally made me love individuals who redeem themselves. And you are almost, without the beard, thank God, you are a modern day Ulysses S. Grant. You know, you have gone from, like you said, you were on the streets, and now today you have a facility in Broad Ripple, which is a section of Indianapolis, Indiana, for those of you listening in other places. Tell us about that before I tell everybody about it. So go ahead.
Sure. Yeah. So, you know, it's a spa. And so I'm really like, I don't know. There's a lot to say about it. I know that God has done this completely. Really, the basis of the whole thing, though, the beauty of it, is that I really want to be able to help nurses or healthcare professionals that are addicted. They are ashamed. They don't want anybody to know that they're getting that help. They don't want to admit it because they don't know what will happen. Will the board be notified? Will they be able to get through this without wrecking their entire career? So, you know, we do a lot of Botox and skin treatments, and you know, so when a nurse comes to the facility or the spa to maybe possibly get a Sublocade injection or to be seen for Suboxone treatment or just really when they come, people don't know if they're coming for Botox or if they're coming for a Sublocade injection, and that's the entire point behind it, is that we're maintaining their dignity. It wouldn't really matter where I was doing this, but I plan no matter when this is in my career, at whatever point it is, I plan to maintain the same type of anonymity for these people, because I'm telling you, ever since, it's been really scary to just come out and be like, hey, this is what happened to me. This is how bad it was. This is where I was 10 or 11 years ago. This is where I am today, because I didn't know. Because of that fear I've carried around with me, I'm not going to lie, I'm deathly afraid at some point someone's going to grab me and jerk me back down where it's scary. It's scary. I'm doing everything that I can to make sure that that is not a position I ever put myself in. But people can be nasty. And it can be scary. So anyway, back to the spa. It's an amazing place. It's in Broad Ripple. It's in a very prestigious area. I don't know how it ended up happening other than just God opened the door up and said, here. His hand is all over my life. And I think it's because I'm not ashamed. Like I'm willing to be that nurse I said I would be. I said if God would restore my life, I would be that nurse I needed all those years ago. I'd put my hand out and be like, come on, let me show you the way. I'll be here for you every step. And I meant that. I meant it from the bottom of my heart. And so I feel like that's why he's like catapulting me in the ways that he has been, because he knows I'm serious. He knows that I mean it.
Oh, absolutely.
Like I don't mean like I'm going to get clean and I'm just going to show everybody who I am today and what I'm doing and look at me, look at me. That is not what it is
No.
at all.
No, it isn't. You know, Chastity, thank you. Oh, before we say, what's the name of the spa?
Le Spa de Beauté.
There you go. That also, not only will the link for the book, the link for Chastity will be in the book, but also there will be a in the podcast notes, I'm sorry, but also the link to the spa's website. I'm going to tell you right now, I cannot say that so I'm not even going to try to repeat it. But I will say that link will definitely be in the podcast notes. There will be a lot more you will see of Chastity. One thing I do want to say is Chastity does practice what she preaches. She does want to help those who are in need. If you are one of those people and you just happened across this podcast and you are wondering what the hell you are going to do to get out of it, okay? Seriously, you now have a link. I want you to click this link. I want you to go to I don't care where you are in the world. People listen to this podcast anywhere in the world. Because obviously she's in Indianapolis, Indiana, but if you are in London, England, if you are in Amsterdam, Netherlands, if you are, I don't care where you are in the world, click it. She will help you. She will definitely help you. I'm going to say that and I'm going to give you a chance to close this out, but I'm going to say this. Because of the demands, at least in the United States, and I would say in North America, period. I think Canada has the same issue. I think Mexico has the same issue as well. There is a shortage of medical professionals. And to be honest with you, colleges and universities are not producing them fast enough. They're just not. And so that even adds to the shortage. I highly recommend, and I know that Chastity probably gave you like the oh my God, I don't think I want to do that. But I'm going to tell you, it is a rewarding career, but we definitely need more people to get in there and be as brave as Chastity and so many other people. And I'm going to say, doctors, great job. You know what? You guys are doing a great job. But the foot soldiers in the medical profession are the nurses, are the CNAs, are the MAs. Those are the foot soldiers. Those are the ones that get the whole thing done, right? You guys show up at the last minute. And I'm not saying that to be mean to the doctors. You know, I'm really not. I'm not saying this to be mean to doctors. I mean, I am a doctor myself, not a medical doctor, but I know how I am as a doctor. I'll show up at the last minute and say, okay, we're good to go, right? That's after everything is almost done, you know? But these people right here, they are the foot soldiers. They are the ones in the trenches. They are the ones that are actually the face of the medical profession, and we need more of them. And I hope we can find a system to make sure more of them come about. Chastity, I'm done with my soapbox. Is there anything you would like to say before we close out?
Yeah, there was a couple of things that I just wanted to mention. You were talking about doctors. I did want to mention that even though I had a bad experience with that particular nurse or those nurses in my issues with addiction, I did want to mention that the light turned back on within me when a doctor spoke life into me. So yes. We all have a position that's very important. I remember him looking me square in the eye when I was having another emergency room visit, and he said, you know, you're better than what you're doing. And I felt the flame of the candle light. And I'm telling you what, I'm still looking for that doctor. I want to thank him. I've looked at my medical records. I can't read his signature. I can't find him. But if I could, I would thank him up and down. You have no idea how much speaking life into someone can change their life, the whole trajectory of it. And I wish.
All it takes sometimes. Yeah. All it takes is a sentence sometimes, doesn't it?
Amen.
All it takes is a sentence. Well, Chastity, thank you so much for being on the program. Again, like I said, I want you to look. The book is called Heroin. You could pull the book up right now on Amazon and this, that, and the other. There is a different edition, an expanded edition that will be released on February the 1st, 2026. It is a great edition. Now, I'm going to tell you, the funny thing is, I mean, I didn't know it was going to be released February 26th, or February 1st, and I did not realize that also February 1st is also very significant in Chastity's life, because it was the beginning of her life. That'll be on her birthday, February 1st. I'm not going to ask you how old you are, because you're never supposed to ask a woman how old they are, and so I will not. I do know that your birthday is 3 days before mine. My birthday is February 4th, and that's it. So it's a great week. The first week of February was great, but I can tell you I know what our parents were doing in May. So there you go. So there you go. There you go. Well, hey, we will be back right after this. Chastity, thank you so much for being a part of the program. Like I said, we'll be right back right after this.
Some fathers teach you how to stand tall. Others teach you how to survive. In Lessons from My Father, Dr. Trunnis Goggins II confronts the legacy of a powerful, complicated man and the truths no one talks about. This is a story of discipline and damage, loyalty and fear, love that left scars. Because sometimes the hardest lesson is understanding the man who made you. Lessons from My Father. Available now on Amazon, Barnes & Noble, and anywhere you buy books.
4Ps podcast. I hope you enjoyed it. I know that I did, and it makes you think. It makes you really think about what goes on in the medical field. We always know there's a lot of stress, and we always know those guys are miracle workers and things like that. But the stress, I mean, they're humans. They're humans, just like we are. And there are things that happen that we just don't fathom. I mean, think about it. If you were in that situation and you had to perform and you couldn't take breaks and you felt that things were going, I would say your job's in jeopardy if you didn't perform at a certain level. And it would lead some people to get into that, and it does lead to addiction. The worst thing about it is, it's like, you have it right there. It's like it's like putting, you just don't want to do it. You just do not want to do that. It's like, for example, if I worked at a sports card shop, I used to love to collect sports cards. I wouldn't make any money, because I would always have the sports cards and I would be taking them because I'd have access to them. And that's exactly what's happening in this situation, where people are, they're addicted, and they're doing things that they're not supposed to do. They have access to things and things like that. But I will say this: I'm very proud of Chastity. I'm proud of her husband for the things that they are doing to make sure that. First of all, there's an awareness, and people understand what's going on in the medical field, and whether we like it or not. And the other thing is they're really out there. They're out there on the street. They're doing things that they're supposed to do to try to stop it and try to combat it. And I'm very proud of them. I love what she's doing with her business and actually helping nurses, giving them a place to relax, giving them a place to heal, and giving them a place to get what they need to make sure that their addiction, to handle their addiction and to treat their addiction. That's one thing that I absolutely love about what Chastity's doing. I love that about her husband, Ryan. They're very good friends of mine. I've known them for about 5 years now, and they're really, they really mean what they say, and they're really out there trying to do the right thing. Next week, we are going to have a phenomenal person on our program. I love this woman. She's a trailblazer. There's no doubt about it. She is a trailblazer in every sense of the word. Her name is Carolyn Brooks Collins. She is from the Atlanta area, and I'm going to tell you, she is a bona fide trailblazer. When you hear what she's doing and how she's doing it and what she has done to open the door for so many black women throughout the United States of America. And you're also going to hear a little bit of history about our country. There's some things that we take for granted today in 2026 that wasn't happening back when she was starting and doing her thing in the corporate world. That is next week. We will have her on the program. Also, do not forget the contest. We're dealing with purpose. There's a actual commercial that tells you about how to do this at the end of this podcast. And also, not only that, do not forget the grand prize this year. You are going to be in one of the Stories of books. It is Stories of Persistence. I do want you to tell me, share a little bit of your story, and you know what? You may be on the next book that comes out it's the final book of 2026, and it comes out in December, and it's called Stories of Persistence. But before Stories of Persistence comes out, the book Stories of Miraculous Transformation will be out. You know, we always do 2 stories of every single year. We've been doing it since 2024, where we had to, because we came up with that idea to release 2 a year, we actually released 2 within 6 weeks of each other. That was stories of children lost, and then stories of veterans. We actually have stories of friends and family lost, and we also have stories of transgression and recovery, and that was for 2025. But for 2026, we will have stories of miraculous transformation, and we also have stories of persistence, which comes out at the end of the year. Stories of Miraculous Transformation will be out in March. Great stories in that book. Oh my gosh, great stories from great authors who have overcome awesome things. I don't want to say awesome things. I want to say it's awesome how they recovered from those things. But it's just outstanding. It's phenomenal. We will be talking to you next week. Until then, have a great day. Goodbye.
Purpose isn't something you find once and forget. It's something you choose every single day. In 2026, how are you living with purpose? The 4Ps podcast invites you to write about the steps you're taking to pursue, sustain, or rediscover your purpose this year. Share the habits you're building, the mindset shifts you're making, the lessons that are shaping your direction. Your words could inspire thousands and be featured on the 4Ps podcast. One winner will receive a signed copy of the 4Ps of You, exclusive 4Ps gear, and official recognition across all 4P platforms. Write with clarity, write with courage, write with purpose. Because purpose isn't discovered once, it's reaffirmed daily.